Anaesthetic training is a global priority.
The year 1846, the first time a patient was administered ether and operated on under anesthesia surgery, unquestionably one of the most important and revolutionary developments in the history of medicine, is the invention of anesthesia. Before this, any form of surgery was a crude and agonizing last resort. Now fast forward 170 years to the modern 21st century healthcare setting. Anesthesiologists do far more than manage the pain of patients during surgery. An anesthesiologist monitors a patient's vital functions like the heart rate, breathing, blood pressure, and regulates anesthesia at all times throughout the surgery. If there are any medical problems that arise during surgery, anesthesiologists are the ones that immediately respond, diagnose, and treat it. It is the anesthesiologist's job to conduct a pre-surgery evaluation and examination so that he or she will be alert and be well prepared to treat them during and after surgery. An anesthesiologist's career is not only confined to the operation room as it extends to intensive care units during childbirth, pain management, as well as respond to emergencies in the hospital, teach and train medical interns and residents. Typical duties of an anesthesiologist includes reviewing comments of other physicians and discussing with other doctors and nurses on the sedation plan of a patient, interview and examine patient, advise the patient as well as the family on what to expect before, during, and after the surgery. A key criteria in an anesthesiologist's career is to have high levels of alertness and to be meticulous. An anesthesiologist also needs to make quick decisions during surgery, as the main goal for the anesthesiologist is to make the patient comfortable and, most importantly, keep them alive and breathing.
The forefront leader in issues of world anesthesiology is the World Federation of Societies of Anesthesiologists. The WFSA acts to unite anesthesiologists around the world in order to promote higher standards of patient care and access to safe anesthesia. They work closely with the World Health Organization, the Association of Anesthetists of Great Britain and Ireland, and any other organizations dedicated to safe surgery on a global scale. Together, their goals are to advocate promoting anesthesia and surgery training as essential healthcare elements, and to encourage global decision-making to promote safer and higher quality anesthesia around the world. In the Western world, we take access to anesthesia for granted. For most of us, surgery is as simple as counting backwards from 10, only to wake up to find that the surgery is already finished. None of us would dream of undergoing a simple surgical procedure, even receiving stitches, without some form of local anesthetic. Unfortunately, for many people around the world, this is not an option. It is estimated that 5 billion people globally are unable to access safe and affordable surgical and anesthetic care when needed. In 2010, an estimated 16.9 million lives were lost from conditions needing surgical care. This figure well surpassed the 3.84 million deaths from HIV/AIDS, TB, and malaria combined. The WFSA is working with the UN under Sustainable Global Development No. 3 to ensure healthy lives and promote well-being for all at all ages, focusing primarily on the reduction of maternal and infant deaths during childbirth. Lack of access to anesthesia and surgery is a major contributing factor to high levels of maternal mortality. In some developing countries, 1 in 7 women die in childbirth due to the fact that as many as 90% of anesthesia departments do not have the equipment needed to provide anesthetic safely to a child. More than 70,000 operating rooms worldwide lack access to basic and necessary anesthetic equipment. The risk of anesthesia mortality can be as high as 1 in 133 in these countries. A study by Bainbridge found that anesthesia-related mortality was 3 times higher in developing countries compared to developed. Aside from the problem of inadequate physical resources, there are significant gaps in the global workforce. In a recent study of 12 developing countries, 11 countries had less than 1 anesthetist or non-physician anesthesia provider per 100,000 population. The worst shortage documented in the study was in the Democratic Republic of the Congo, which had 1 anesthetist for every 5 million people. In another study of 22 countries, irrespective of the size of the hospitals or complexity of cases, nurses or clinical assistants were the main providers of anesthetic care, often without supervision or adequate training. This has been recognized as the rule rather than the exception in most developing countries. Recruitment and retention of anesthetic physicians also remains a significant challenge. Training opportunities for anesthetists is mostly limited by the cost and availability of equipment and medications, particularly general anesthesia. In Uganda, training positions remain unfilled because potential employees are unable to afford the cost of specialist anesthetic training. Similar workforce problems exist in other sub-Saharan African countries. In Kenya, only 13 of the country's 120 anesthetists work in public hospitals. The issue of lack of access to anesthetics and anesthesiological training is fast becoming one of the most important medical issues of today.
In 1992, the WSFA outlined general standards of anaesthesiology and in 2009 developed a new questionnaire or checklist based on the international standards consisting of evidence-based vital checks in 3 phases: before starting anaesthesia, before starting surgery and at the end of surgery. WSFA is working with the International Committee of the Red Cross to ensure safe anaesthesia for patients admitted to Red Cross facilities globally. They also launched the Safe Anaesthesia for Everybody Today campaign at the 16th World Congress of Anaesthesiologists in Hong Kong in September 2016. The safety campaign was born out of a social media advocacy initiative with the same name launched on World Anaesthesia Day 2015. Another important global programme with a similar acronym is the Safer Anaesthesia from Education programme, SAFE. This is the training initiative done together with the AAGBI and the WSFA with the aim of bringing local practitioners in underdeveloped countries to a level of practice where they can deliver vigilant and competent anaesthesia, particularly in the area of obstetrics. The SAFE course has been delivered to 9 countries so far with excellent results. One such country is Uganda, which has a maternal mortality ratio of 435 per 100,000 live births, but in some areas this number can be as high as 1,200. The most evident issue here is a lack of resources, mainly of adequately trained anaesthetic staff. Most of the workforce comprised of non-medically trained anaesthetic officers, individuals who are not doctors but rather healthcare professionals with a basic understanding of anaesthesia. The SAFE programme aimed to improve the training of anaesthetic officers in these areas, particularly rural zones, to help deal with critical injuries and pregnancy complications. 366 new anaesthetic officers were trained across its duration, nearly doubling the number of healthcare professionals able to deal with anaesthesia emergencies in the country. The same story can be told in many other countries such as Liberia, Ghana and Ethiopia. The SAFE programme hopes to expand even further to help bring proper anaesthesia education and training to professionals around the world. The global burden of disease is shifting, with the increasing incidence of surgical diseases disproportionately affecting developing countries with poor access to anaesthesia. The global health community must recognise the importance of essential surgery and safe anaesthesia and prioritise it as part of an integrated effort to improve health systems. Improving access to safe anaesthetic care will require a systematic research into resource gaps in local and global settings and innovative funding solutions to improve anaesthetic workforce, equipment and infrastructure. With more than 230 million major surgeries occurring annually and the worldwide death rate during full anaesthesia on the rise, anaesthetic training really is a pertinent global issue.